I start, I would like to ask two questions. Please give me correct answer. Is there anybody here who never took any antibiotics in the past? Raise your hand. You have two hands. You could have. Is there a second question? Is there anybody here who will not take any antibiotics in the future? No hand is going up. Therefore, in the past, someday you are a patient. In the future, and someday you will be a patient. I would like to address you, my dear patients. Today, I don't know what a coincidence. It is bringing a mixed feeling in my slide. Today, in the year 1998, same day, October 3rd, at about 11:30 in the morning, I was sitting in my office at St. John's Medical. There was a young couple walking in front of my room. I saw them. They were hesitating to come inside. I asked my secretary, who are they? Secretary said, sir, they have come to see you. They have a baby, sick baby. I said, call them inside. I went outside and called them. They came. They refused to sit on this chair. Very poor people, husband and wife. Very young, with a beautiful 3 months young child. Later on, I realized it was a female child. I asked them in Kannada what they wanted. They could not understand. They said, Hindi malum hai sahab. I know little Hindi. I said, kya chahiye? Then they gave me the slip. In the hospital, my intern had examined this child. Child was getting convulsions after convulsions. And it was only 2.5, 3 months. Female child, very cute child. The moment I looked at the child, looked at me and smiled at me. That was the first love with the child I had developed. It was getting convulsions. Then my intern asked, where are you working? He said, private. Normally, doctors will write private, keep quiet. But this intern, private mein kya kaam kar rahe ho? What work you are doing in private? He said, I am collecting old batteries, breaking it, making pipes for the toilets because it will not get corroded. For our benefit, he was collecting old batteries, breaking it, cutting it, melting it, making pipes. He earned some money. He got married. He's from Bihar. He made a house, one shed. In one corner, he was melting lead. In another corner, his wife was making roti. Imagine the environment in which she became pregnant, delivered the child. Remember, the lead from the environment has no placental barrier. Every one of you may not have symptoms of lead poisoning, but you have lead in your blood. I'll tell you. The child, after it was born, had several convulsions. What they say in Hindi, mirgi. Then we had to measure the blood lead level. We had a wonderful technology. Then I said, Khoon ka test karna hai. He said, Kitna? How much it will cost? Poor fellows don't have footwear. They have come walking all the way from Nimhans to St. John's. Ravi, from your institution. Because lead was not estimated at Nimhans at that time. And they searched in all their pockets. They had few rupees. I said, you don't have to pay. I had that freedom to waive the fees without asking the management. Technician came, pricked the heel. Child never cried. Then I liked that child. I took that child in my arm. He went and he asked, Kitna time lagega? I said, it's 5 minutes, 3 minutes test. 5 minutes will get the result. In the meantime, the child got a very powerful convulsion. It became still. I knew something has gone wrong. Immediately I told my secretary, call the nurse, call the pediatrician, somebody. They came and checked, said, sorry, sir. The moment any doctor says sorry, you know what? The child was dead. It was no longer alive. It was in my hand. The child which smiled at me was no longer alive. Blood report came. How much? 69 micrograms per 100 ml of blood. Microgram, you can't see milligram. 1000 microgram will make 1 milligram. I was running the project lead free. How can I do lead free project? We have thrown so much of lead in our environment. Then I had to tell them the child is no more. I could not keep the child on the table, not give it to them. They cried. My colleague could not control their emotion. Somehow body was handed over. I went home for lunch. My wife served the lunch. I could not eat. Same hand with which I was holding the baby. I could not eat. I said, I cannot. What happened? I said, I lost one child, female child. I told her what happened. She asked me one question which I'm asking you. She said, is that child born to their parents out of choice or by chance? I'm asking same question to you. Are you born to your parents out of choice or by chance? By chance. Nobody was selected. How many millions of whose parents are working with some form or the other in toxic substances, lead, cadmium, mercury, arsenic, etc. Have we protected them? Even bacteria will die when lead is there. More powerful than antibiotics. This is the environment. Do we have that clean environment around us? I am going to talk about environmental pollution. Any kind of dilution is not a solution for pollution. Remember, any kind of dilution is not a solution for any kind of. Therefore, One Health is connecting human, animal, and environmental health. My morning colleagues have briefly mentioned. I can change here. Okay. What is One Health? Everybody knows. But have we realized? Have we made any efforts? The interconnectedness of human, animal, and environment. This year, 2024, WHO said, my health is my right. My right, my health. As a guideline development group member of WHO, I said, it is not true. My right is my animal health. If my animal is sick, I'll be sick. My health is my environmental health. If my environment is unhealthy, I will be a threat to my health. My agricultural products loaded with pesticides, insecticides will determine what my health. Therefore, whether WHO, CDC, World Organization for Animal Health, All of them have now, I'm very happy to tell you, they have come together. And one good news is our G-SPARC has brought all of them. In fact, my long dream of getting vice chancellors of Health University, Agricultural University, Veterinary University on one platform, thanks to our organizers, a wonderful effort. Can you change? Okay. Lead is number one environmental point. It is there in your drinking water. If I take this drinking water, it is written on that carbohydrate zero, protein zero, fat zero, as if they should add all this and give it to you for the money we pay. Why not they mention mercury zero, cadmium zero, lead zero? Have you made such effort? We have seen pencils, mended pencil, one side, one end to write, another end to chew. Paints, the pencils given to children are painted. That paint contains 12.5% lead. The children chewing the pencil, they get enough lead to reduce their IQ. Therefore, it is one of the largest health global study undertaken in India. I am going to tell you, in one health, one life, one world, largest global study was taken in India between 1996 to 2000. What happened? We knew that 168 countries on this earth were using leaded petrol. Only US, Australia, Europe, they were not. Then I had a challenge. Somebody said, I will give you machine, I'll give you funds. Will you do blood lead level of Indian population? I said, I'm more interested in children because there's no placental barrier. There's no blood-brain barrier. Once lead gets into the brain, permanently it gets reported. We collected the blood from 23,500 people between 1996 and 2000. We measured their blood lead level. I'll tell you shocking news, which we released on 11th of November 2019 in a global meeting. What was the result? 51.3% of Indian children below 12 years, as on 1999 November, had their blood lead level above 10 microgram per deciliter. So what? IQ was reduced in all these children by 68 units. They have not become idiots. If the situation had continued, they would have become morons and idiots. Then we submitted it to Government of India. We said our environmental health is poor. There's a lot of lead because of vehicular exhaust. Said, so what? You scientists bring data. What do you want us to do? I said, don't add lead to petrol. They won't listen to us. They said, we have purchased about 5,000 metric tons of tetraethyl lead. What to do? I said, bury it in some desert, deep. They won't listen. Our team went to Washington. The World Bank had supported our study. We said, please give a letter. If developing countries do not introduce unleaded petrol, no more World Bank loan. Give 3 years time. By 2003, if any of the developing countries do not fail to introduce unleaded petrol, no more World Bank loan. This came to our Parliament Secretary. I tell you the miracle. You scientists must work with politicians. Your one foot should be in the lab, another foot should be with decision makers, policy makers. By March 2000, all over India, we had unleaded petrol. That is the greatest achievement. Environmental correction was not made by you and me, made by the policy maker. That is the largest One Health global project which was taken up in India. Next, please. Go to the next slide. Importance of One Health. My colleagues are going to talk about this in detail tomorrow. Prevents zoonotic diseases. I tell you, during COVID time, I made a prediction that 2020, I said, by 2022, there will be 50% reduction in the population blood lead level. I published it in Lancet. By 2022, December, 50% reduction will be there in the blood lead level all over the world. It came true. Reason is, between 20 and 22, what good behavior all of us had. Without washing hands, we never eat. Without mask, we never spoke to somebody. We never hugged another person. We did not shake hands. Did namaste. I tell you, we never traveled outside. We stayed at home. We never went to office, worked from home. I tell you, great practices were there. As a result, we are not exposed to dust. Lead in the form of dust enters through our body. That is called the metallic lead. We inhale. It goes to lungs, goes to blood, goes to all organs. It has no it follows impartiality. It doesn't differentiate between two people sitting here. Of course, also this One Health addresses antimicrobial resistance, which has been discussed in depth, enhances environmental sustainability, improves global health policy. Coming back to lead. Lead kills all bacteria. I was in Pakistan to deliver a talk. I gave a talk on how to minimize the use of surma. Surma is the eyeliner. I told them, these girls here, beautiful girls in my neighbor country, will suffer from problems with their eyes. Why? Surma is lead sulfide, antimony sulfide. Thanks to their government, they introduced it. Went to Bangladesh. I suggested you should have lead-free turmeric. The first country in the world, only country in the world which could introduce lead-free turmeric is Bangladesh. I was there about 2. I tell you, India, we depend upon turmeric. We don't have a turmeric without, because even Maggie issue, which had brought out, had lot of lead in that, and Nestle created massive awareness, which I could not create in 20 years. They created in 6 months. What is that? Maggi contains lead in their masala sachet. Instead of turmeric powder, they were adding lead chromate. Enhances environmental sustainability, One Health, improves global health equity, and also improves the financial status of a country. When we presented the data, 51.3% of children having IQ reduced by 8 units, in another 20 years, they become human productivity to do 4 hours work, they take 8 hours. As a result, there was we predicted annual economic damage to a tune of 600,000 crores, budget of 2 Jharkhand. Go to the next one. One Health principles. This is the thing. We was hit the nail on the head. I'm extremely happy to see people from different disciplines, interdisciplinary collaboration. This conference should bring us together. We should get in our subject married to each other. Then only we can achieve some transdisciplinary research. Today, Chief was here, Tata Institute of Genomic Studies, and global cooperation, local engagement, sustainable development. This is what our key principles of One Health, which will be discussed in greater depth by my colleagues. Go to the next. Now, beautiful picture on one hand, 5 bees, big animals, maybe from Africa, other hide a tree, and it's 2 hands holding, saving, protecting oneself. Go to the next. And of course, COVID-19, Ebola, you're all aware of that. These are all One Health concerns. Go to the next one. I will not go into these details for lack of time. And my colleagues from the veterinary university will be talking about rabies and Ebola responses in West Africa. And these are all zoonotic diseases control, which has been successfully done. Go to the next one, please. Food safety security. 68 spices from India were banned for export, for import from UAE. Salmonella reduction in poultry. I tell you, discarded, date expired. Antibiotics are still used in our country in poultry and animal house, which I personally went in. And 99% of high-end surgeries like transplants, which are done at a very high 7-star hospitals, they come back with a surgical site infection, which is not responding to any antibiotics because they are non-vegetarians, because they're consuming metabolites of antibiotics given to these animals and birds. Safe fish consumption in Ghana, One Health initiative, improved fish handling and consumption practices, reducing foodborne illness. See how beautifully, if all of us, not just medical people, health, not just veterinary, not just health, we together share the knowledge, bring out a policy as a white paper, any government will accept. I promise you. Next.
So if you could wrap up soon.
Pardon?
If you could wrap up, the time is up.
Okay. That's over. There are 1 or 2 slides. One Health approach protected endangered species and habitat, promoting human livelihood all over the world, and antibiotic stewardship in agriculture. It has become quite popular and people are dependent on that. Next, please. Human-animal interface is, you're all aware, domestic animals, livestock. Go to the next one. I'll go to the last slide. Global health security agenda, multi-country collaboration, strengthening capacity to prevent, detect, and respond to infectious diseases threats. And One Health approach improves coordination between human, animal, and environmental health. Can you move on to the next one? Therefore, there's a lot of economic benefit. Go to the next one. What are the other things? Community engagement is required here. And of course, policy and advocacy is the ultimate, for which we need to provide right type of information. High-end research is not required now. A lot of information is available. Based on that, we can move any government to make the society safer place to live and make the environment lead safe, not lead free. Thank you very much.
Thank you very much for that fascinating talk.